Hypertension is high blood pressure. It can be classified by its cause. Most hypertension, we don't know why it's caused. That's 90% of the cases. And we call it essential or idiopathic or primary hypertension. In only 10% of the cases do we know what causes it. And we call that secondary hypertension because it is secondary to another disease. High diastolic blood pressure is no longer considered to be more dangerous than high systolic blood pressure. Studies have shown that elevated systolic blood pressure is strongly associated with heart failure, stroke, and renal failure. For those older than age 50, systolic blood pressure is a more important risk factor for cardiovascular disease than diastolic blood pressure. Pre-hypertensive blood pressures are no longer considered high normal and require lifestyle modifications to prevent cardiovascular disease. So what we used to think of as just high normal, no, we're saying you need to change your lifestyle with these. Now, if you remember, blood pressure is the product of cardiac output and systemic vascular resistance. The cardiac output piece is a combination of the heart rate, the contractility, which is the strength of the contraction of the heart, and also the volume of what's in the blood vessels. You can't put out a whole lot if you don't have much in there. Systemic vascular resistance is a factor of how much are the vessels constricted and how much are they dilated. So, if someone has hypertension, we can address it by decreasing the heart rate, decreasing the contractility, decreasing the volume, or increasing the vasodilation. Hypertension, the risk factors. Well, we have family history, the presence of diabetes, and aging. Family history and aging, you can't do a whole lot about. Diabetes, once you got it for life, but you can control it. And that will help somewhat with the presence of hypertension. The things that we can change are sodium intake, alcohol intake, obesity, smoking, and a sedentary lifestyle. Let's look at the pathophysiology briefly. There's a vasoconstriction or an inadequate vasodilation going on, which causes elevated blood pressure. This is going to cause vascular damage and organ damage. The high pressures and vasoconstriction damage the linings of the blood vessels. This results in an inflammatory response and a consequent increased vascular permeability, which is then going to cause further vessel damage. The vessels adapt. They adapt because they need to withstand and stand up to the stress, and they do this through hyperplasia and hypertrophy. So we're getting lots more cells within the vessels and lots bigger cells within the vessels, which means that the lumen, the opening of the vessels, is going to be permanently narrowed. And that means there's less blood flow to the organs and tissues. With less blood flow, you have hypoxia, and therefore you end up with organ and tissue damage. While hypertension affects all body systems, 3 systems are most affected: the central nervous system, the cardiovascular system, and the renal system. Now, initially, we don't see a lot of symptoms. We might not see any. But as the disease progresses, we get central nervous system changes: headaches, blurred vision, weakness, nausea, vomiting, fatigue, confusion, mental status changes. There are cardiovascular changes. As well as the vascular damage, we see pulmonary edema and heart failure. Renal insufficiency. We'll see poor urinary output. And within the urine, there may be blood and protein. And the body has a difficulty getting rid of the waste products through the urinary system. Okay, hypertension, fairly recently, we had a switch in nomenclature. So we now classify hypertension as prehypertension, stage 1, and stage 2. Prehypertension, systolic is 120 to 139, and diastolic is 80 to 90. Stage 1 and Stage 2, you can see here, and they are also described in your text. So how do we treat it? Well, there are medications available, but of equal importance are the lifestyle modifications. So what are they? Well, let's look at one of the previous slides. What changes should we make? The lifestyle modification. Decrease alcohol and salt consumption. Decrease saturated fat consumption. Increase fruit and vegetable intake. We're looking at weight reduction here. And along with that comes exercise, especially the aerobic type. And absolutely stop smoking.